The new patient care center at Royal Jubilee Hospital has been years in the making, and it all comes down to this weekend. The tower is ready. Now it's time to move in. Hundreds of hospital patients will be transferred, and it will be done with surgical precision. It is estimated to take 11 minutes for each patient, and it all begins Sunday morning at 7 o'clock. Mary Beth Burton has the story.
2 more sleeps for patients at the Royal Jubilee Hospital before the new patient care center opens. This is where some patients are now, in the general medicine ward with 20 beds. The building is about 80 years old. Some rooms are shared, and the hallway is almost comically congested. Sunday morning at the crack of dawn, patients will leave the center block for good.
About 5 a.m. we'll arrive and get all ready. The teams will go out into the units. Make sure everybody has breakfast, their meds and everything, and then we'll start to move the first patient at 7 a.m.
How's this for a lineup? 10 stretchers are waiting here for patients on the move on Sunday. Dollies are stacked and ready too. Every patient will be escorted by a nurse and a porter. A Victoria company, Care Relocators, is overseeing the move.
Our role will be to facilitate the outside company that's going to actually move the patients. We'll be supplying equipment and some members of our portering staff.
The old wards will be dead bolted when cleared on Sunday, and demolition is expected in the fall. 260 patients in all from the old Jubilee will be moved indoors only, and mainly along the breezeway between the old and new facilities. Each patient move is estimated at 11 minutes.
All these things have been tested again and again and again.
This is a room in the new patient care center.
All but 2 of the 500 beds, I suspect, right now would be ready.
Construction was complete in January.
We have 20,000 pieces of equipment that we had to procure and install and test in January, February, and the first 2 weeks of March.
Staff are anxious for a more modern approach to medicine.
On every floor of the patient care center, we have collaboration centers. Used to be called the old nursing stations, but we know that there are far more professionals than just nurses in the hospital.
All health staff will coordinate patient information at these stations. There are a few minor touch-ups, but the chief project officer predicts the patient transfer will be complete by 5 p.m. Sunday. And there are another 80 mental health patients who will be transferred to the new patient care center on April 9th. In Victoria, Mary Beth Burton, A News.